Hello doctors, welcome back to our NEET MDS 2021 recall series. In this video, we are going to see about an important index, that is DMFT Index, from the subject Community Dentistry. The question they have asked from NEET MDS 2021 was, it was an clinical question. So a female patient of age 28 years, so 28 years, has temporary restorations on 4 fractured anterior teeth, 8 teeth with chalky rough spots, and 3 third molars are extracted due to pericoronitis. So this is what we have observed in this female. Okay, so 4 are fractured, 8 are having chalky rough spots and rough spots. Okay, and 3 of them, 3 third molars are extracted. Okay, this is what we are observing right now. So we need to calculate the DMFT score according to WHO. Okay, keep this in mind and we will calculate it after knowing what is DMFT score and after knowing how it is given by WHO. So the options they have gave is 1, 8, 0 and 4. Okay, let us just dive into the concept now. So a DMFT score. So DMFT is nothing but D is decayed, M is missing due to caries, F is filled teeth. Okay, so this is what is DMFT means. Okay, so it is used in permanent teeth. Okay, so this index is used in permanent teeth. Then an examination of dental caries in permanent teeth means examining 32 teeth, of course, with a metallic periodontal probe. That is what probe we use, community periodontal index probe, that is CPI probe, that is shown in this image, and a plain mouth mirror. Okay, the permanent dentition status of each tooth, crown and root, both crown and root are measured, is recorded as a score from 0 to 9. Okay, so this is important. Then coming to DMFT score. So we have seen that it is given from 0 to 9. So from 0 to 9, what all it represents? So let us see that. So 0 is sound. What is sound? So a crown or root is coded as sound if it shows no evidence of treated or untreated clinical caries. That is, it is a natural tooth without any disturbance. That is sound. Then number 1 is given for a carious crown. So caries is recorded as present when a lesion in a pit or fissure or on a smooth surface has unmistakable cavity, undermined enamel, and detectable softened floor or wall. Then it is considered as a carious tooth. What about carious root? It is recorded when the lesion feels soft or leathery on probing. Okay, that is what is carious root. Then coming to crown filled crown with caries. So a crown is considered filled when after affected by caries when it has one or more permanent restorations and one or more areas that are still decayed apart from the permanent restorations. Okay, so this is what is filled crown with caries. So filled root is also the same thing. It is filled but with one or more permanent restorations, but it also has one or more areas that are decayed. Okay, keep that in mind. Then coming to number 3, filled crown with no caries. No caries means quite opposite to what number 2 is, right? So here the crown is considered filled but without caries. 1 or 2 permanent restorations are present and there is no caries activity seen in crown. The same goes with root also. 1 or more permanent restorations are present but no caries anywhere on the root. So this is what is the first 4 numbers indicate. Then coming to number 4. Number 4 is missing tooth due to caries. So missing tooth due to caries. This is very important. Okay, only the tooth should be missed due to caries. Okay, the permanent teeth that have been extracted because of caries and recorded under coronal status. Okay, and number 5 it is permanent tooth missing due to any other reason. Any other reason might be, it might be congenitally absent or extracted for orthodontic reasons or because of periodontal disease, trauma, anything may happen. So then that is considered as number 5. Then 6 is presence of fissure sealant. So this code is used for a tooth which has a fissure sealant that has been placed on occlusal surface or in pit, or for teeth in which occlusal fissure has been enlarged or rounded with a flame shaped burr has been used, a composite material has been placed. Okay, so this is where we use number 6. So this is fissure sealant or some composite material that is kept to arrest the caries. Okay, then coming to number 7. Number 7 is fixed dental prosthesis abutment, special crown or veneer. Fixed dental prosthesis, that is FPD, abutment, special crown or veneer. This code is used under coronal status. Coronal status means the thing which is disturbed by caries. Okay, to indicate that the tooth forms part of fixed bridge abutment. This code can also be used for crowns placed for other reasons other than caries also, and for veneers, laminates covering the labial surface of tooth on which there is no evidence of caries or restoration. So number 7 is used in both carious and non-carious tooth, where we keep FPD, abutments, veneers, okay, and other kind of special crowns. Okay, then coming to number 8. Number 8 is unerupted tooth or crown. So this classification is used only for a tooth space with an unerupted permanent tooth, okay, that is submerged into the mucosa. Then number 9, it is not recorded. This code is used for an erupted permanent tooth that cannot be examined. That why it cannot be examined? There can be reasons such as orthodontic bands that are there, or severe hypoplasia, or some conditions like this. So this is what makes the tooth not recordable. So these are the codes that we use in DMF. Then coming to the WHO modifications for this DMFT, it was given in 1986. Okay, so third molars are included according to WHO. So in that we have seen in those codes we have not spoken about third molars at all. Okay, so third molars included in WHO. Teeth with temporary restorations are considered as decayed. So teeth with temporary restorations are considered as decayed. Okay, but that too, that temporary restorations are placed in carious teeth. Okay, when the temporary restorations are placed in carious teeth, then it is considered as decayed. So initial caries is not regarded as decayed. Okay, so these are the modifications given by WHO. Coming to a small note, so individual DMFT value is the sum number of decayed. Individual DMFT means a single person. Okay, decayed, missing and filled. Decayed, missing due to caries. Okay, this should be in your mind. Filled teeth and permanent teeth. So when we are calculating it for a single person, we do this. Okay, so the D component includes teeth with codes 1 and 2. So codes 1 and 2 are filled carious teeth and filled with caries, right? Then the M component comprises teeth coded 4 in subjects under 30 years of age. So the teeth coded 4 is, we have seen, right? The teeth coded 4 and the teeth coded 4 or 5 in subjects 30 years or older. So this is considered as missing due to caries or for any other reason. That is what 4 and 5 is. Missing tooth due to caries or a missing tooth due to any other reason. Okay, and the F component, that is filled component, includes teeth with 3. That means filled with caries. So that is only considered in F. Okay, teeth coded 6, coded 7 are not included in calculations of DMFT. Okay, So these are not included in calculations of DMFT according to WHO. Okay, this is according to WHO. Okay. So coming back to the question. So in this question we have a female of 28 years of age, that is she is less than 30 years of age, then has temporary restorations. So four are fractured teeth, okay, and 8 are chalky teeth, and 3 are third molars that are extracted, but it is due to pericoronitis. Okay, so we have to calculate now the DMFT score based on WHO, right? So according to WHO, the fractured teeth with temporary restorations are not considered. If the temporary restorations are present on teeth that have been damaged by caries, then only it is considered. So hence this is 0, right? So hence that will be temporary restoration will be 0. That is, this is the filled teeth component that we have. And 8 chalky rough spots. So incipient lesions are not considered as decayed according to WHO. So hence this is also 0. So hence decayed part is also 0. And 3 third molars are extracted due to pericoronitis. Since they are extracted due to pericoronitis, it is also considered as 0. Whereas if it is extracted due to carious lesions, then we might have considered these teeth. But since it is extracted due to pericoronitis, it is 0. So hence missing components are also 0. So summing up, the decayed, missing and filling teeth, the DMFT score is 0 for this female patient. So the answer will be option C. I hope it is clear for you right now. If you like our video, do subscribe to our YouTube channel. You can also follow us on our Instagram handles at Docshala for dental content and at Docshala Medical for medical content. You can also find us on Telegram. Thank you.